Good day everyone, I am Ivan Carla Candola from BSN 1Y2-3. Today, I will be performing a return demonstration on how to assess the abdomen of our client. To start off, we must observe the standard protocols.
First, we need to verify the doctor's orders regarding any restrictions and/or limitations.
After that, we should perform hand washing and observe other appropriate infection control procedures like cleaning and disinfecting all surfaces and equipment needed to ensure a safe environment for us and to our patient as well. We also need to apply for the principles of body mechanics as part of the standard protocol. This involves using a good posture where you keep your head upright and your shoulders back. The next thing that we should do is to prepare our client. Good morning, sir. I'm Ivan Carla Candola, your student nurse for today. For verification lang po, can I take a look at your patient tab po? May I know your full name, sir?
Candola.
How about your birthday po?
October 21, 2010.
Alright, thank you, sir. So for today po, I'm going to assess your abdomen and I will do some inspection, auscultation, percussion, and palpation on certain parts of your abdomen. And in order to do so po, I'll be exposing your abdomen. Is that alright with you, sir?
Yes po.
Keep in mind that we should maintain the comfort and safety of our patient. Additionally, always keep the privacy of our patient throughout the procedure.
Next, we need to prepare the materials needed for the assessment. For this assessment, we would need a stethoscope, a skin marker, a centimeter ruler, and a small pillow or a rolled blanket. To start the main procedure,
ask the client to empty the bladder before beginning the examination. This will help to eliminate bladder distension and interference within the examination. Have the client remove all of his clothing from waist up and put on an hospital gown or drape. Help the client to lie supine with the arms folded across the chest or resting by the side. Slightly flex the legs by placing a pillow or rolled blanket under the knees to relax the abdominal muscles. Cover the upper and lower body part of the patient, leaving only the abdomen exposed from the xiphoid process down just above the symphysis pubis.
Are there any painful or tender areas around your abdomen po, sir?
Wala po.
Alright, kung wala po, sir, I'll begin inspecting your abdomen by observing its coloration. Also, if there are any vascularization, scars, rashes, or lesions on your abdominal skin po.
Also observe for the changes in contour, symmetry, and surface movements. In order to check the abdominal symmetry, sit beside the client and look across the abdomen at a level slightly higher than the patient's abdomen. Then, do the same thing while standing on the foot of the bed. Additionally, observe for the umbilical cord color, location, discharge, and contour. Note that the umbilical skin tone is similar to the surrounding skin tone or even pinkish.
Alright, now sir, I'll be using a stethoscope to listen to or to auscultate for your bowel sounds po.
Auscultate the bowel sounds using the diaphragm of the stethoscope. Begin in the right lower quadrant and proceed clockwise to cover all quadrants. Listen for at least 5 minutes, noting for the intensity, pitch, and frequency of the vowel sound. You don't have to hear sounds in each quadrant. As long as there's some sound somewhere with pauses, that's okay. Stomach growling or borborygmus is normal if the patient is hungry. Constant continuous vowel sounds is not. That's associated with increased motility and might indicate gastroenteritis or early stages of abdominal obstruction. Absent vowel sounds are defined as 5 minutes with no vowel sounds at all. They are a late sign of abdominal obstruction. Now, to listen for the vascular sounds, use the bell of the stethoscope to listen for any bruits over the abdominal aorta, renal, iliac, and femoral arteries. Also listen for the venous hum using the bell of the stethoscope in the epigastric and umbilical area. Lastly, auscultate for friction rub over the liver on the right and left lower rib cage with the diaphragm of the stethoscope.
Alright, so sir, now I'll be moving on to the next step po, which is the percussion of your abdomen. So I'm going to do some light percussive testing across the 4 quadrants of your abdomen po to help me determine whether you have tympany or dullness po. So start na po ako, sir.
Okay.
Next po, sir, I'll be determining your liver span po. I'll be getting the span or height of your liver by determining its upper and lower borders po. So, allow me po to write on your skin using a skin marker po, and then it will help me to measure the distance po. Is that alright with you, sir?
Opo.
Okay po. Let me repeat the percussion po again, sir, on the mid-sternal line po. Now po sir, I'll be doing the scratch test po to ascertain the location and size of your liver and spleen. So now po sir, I'll be percussing your spleen by beginning on the posterior part and then going to the left mid-axillary line and then downward po. Next po sir, I will do the blunt percussion on your liver po to assess for any tenderness.
Do you feel any pain or tenderness, sir?
Wala naman po.
Okay po. Lastly, reposition the patient into a sitting position and perform the kidney blunt percussion to assess for tenderness in difficult to palpate structures. May pain po ba, sir, or tenderness?
Wala naman po.
Okay po, sa kabila po. May pain po ba, sir?
Wala naman po.
Okay po.
Higa na po kayo ulit sir. Okay, this time po sir, I'll be palpating your abdomen. So I'll start by using light pressure to palpate the 4 quadrants of your abdomen to determine any areas of tenderness and muscular resistance po. If you feel any discomfort po, kindly tell me po sir. Alright sir, this time naman po I'll be using deeper pressure to palpate, to delineate abdominal organs, and to detect subtle masses po. Again, if you feel any discomfort, kindly tell me po sir. Now po sir, I'll be palpating for the aorta and epigastrium slightly to the left of the midline po.
Next, palpate the liver for consistency and tenderness by putting your left hand underneath the back along the 11th and 12th ribs, supporting the abdomen while the right hand palpates the right upper quadrant. For the spleen, the left hand goes over the abdomen and loops around underneath the back, also at the 11th and 12th ribs, supporting the abdomen. Meanwhile, the right hand palpates the left upper quadrant with fingers angled towards the armpit. For the right kidney, put your hands together and squeeze into the right flank while the patient inhales. You may or may not feel the kidney. For the left kidney, the left hand goes over the abdomen and under the left flank, supporting the abdomen while the right hand palpates. Even though the patient is breathing deeply, we usually won't feel the left kidney anyways. In addition, palpate for the urinary bladder by beginning at the symphysis pubis and move upward and outward to estimate bladder borders. Assess for rebound tenderness for any abdominal pain or tenderness. Away from any painful areas, push one hand perpendicular into the abdomen, slowly and gently pulling the hand away quickly. Assess the rousing sign by palpating deeply in the left lower quadrant.
May pain po ba sir?
Wala naman po.
Assess the psoas sign by placing your hand on the patient's right knee, and if the patient lifts his leg against your resistance, any pain or discomfort in the right lower quadrant by flexing the leg we're tensing would be a positive psoas sign.
May pain po ba?
Wala naman po.
Okay po. For the next one po sir, I'll be doing the obturator sign po. So angat ko lang po ito Okay? And then, sabihin niyo po sa akin kung may pain or discomfort po, okay? May pain po ba?
Wala naman po.
Okay po. So, for the last one po, sir, we will be doing the hypersensitivity test po.
Using a sharp object, stroke the patient's abdomen. Perform this action multiple times and pay attention to any reports of discomfort.
Do you feel any pain or discomfort as I do this po, sir?
Wala naman po.
Pain or an exaggerated sensation felt on the right lower quadrant is a positive skin hypersensitivity test and may indicate appendicitis.
So, that concludes our abdominal assessment po, sir. Let me just document pertinent data that we have gathered all throughout the assessment po. Alright, sir, let me state the summary of findings of what we have just done po. Upon inspection po, your abdominal skin is uniform in color and there are no vascularization, scars, rashes, and lesion as well. Your abdomen po is round, it is symmetric, and there's no visible peristalsis po unlike to thin individuals po. Your umbilical color naman po is almost the same as the surrounding skin color po. And your bowel sounds po were present in all 4 quadrants po of your abdomen. Your liver span in the mid-sternal line dito po, sir, it is 5 cm po and 8 cm in right mid-clavicular line dun po sa gilid. Both of which naman po, sir, are within the normal range. Your abdomen po is soft to palpation, there were no tenderness, there are no masses. Additionally, your liver po, your spleen, and your kidneys are non-palpable po. In summary, sir, your abdominal examination is considered to be normal because it appears that everything in your abdominal region is functioning normally and you should maintain it, sir. Thank you so much po for your cooperation, sir. Have a good day ahead po. Thank you po.